everyone. Good morning, good afternoon, good evening, whatever time it is you're watching this. Sorry, we have been having some technical difficulties this morning. Um, anyways, yes, I know I'm somewhere different. We took a little getaway this weekend for Sean's birthday. And though his birthday was in February, this was kind of a late thing. And yeah, so we're getting ready to head back home. Then we have Bentley, say hi. All right. Home this weekend and or headed home, so you may hear a little noise. I'm finishing up just a little bit and getting packing and loading the car and stuff. Let's see if I can do this without the internet dropping out on me again. All right. So, what are you drinking? I'm drinking the hotel's orange spice with some organic stevia. Yes, I've gotten the little packets, like travel packets or whatever that you can travel with. So, I travel with that so I can add it into my tea if I need to. All right. So, multiple myeloma. Um, like I always said, knowledge is power. Multiple myeloma, it's March, so it's Multiple Myeloma Awareness Month, as well as Kidney Awareness Month, as well as Colorectal Cancer Awareness Month, and Women's History Month. All right. So, um, multiple myeloma is a cancer that forms in a type of white blood cell called a plasma cell. Healthy plasma cells help fight infections by making proteins called antibodies. Antibodies find and attack germs. So, um, I'm sure a lot of that you're familiar with, or at least the wording. The symptoms. Symptoms are bone pain, especially in the spine, chest, or hips, nausea, constipation, loss of appetite, mental fatigueness or mental fogginess, or confusion, tiredness, infection, weight loss, weakness, thirst, needing to urinate often. That goes for a lot of things. So I always say, if something just doesn't feel right, go get it checked out, right? I mean, it may not be anything. How do you get diagnosed? Blood tests, urine tests, bone marrow tests, imaging tests such as X-ray, MRI, CT, and PET scan. Treatments, target therapy. We talked about that, I believe, in the cancer one or the Kidney Cancer Awareness Month. What target therapy is? Immunotherapy, CAR T cell therapy, which that actually trains your immune system to fight multiple myeloma. So they remove some white blood cells, including T cells, and they send it to a lab. And in the lab, the cells are treated so they make special receptors. And then the receptors help the cells recognize a marker on the surface of the multiple myeloma cells. And then they are then inserted back into your body or put back into your body, and they can now find and destroy the multiple myeloma cells. And I think this is something fairly new. Remember, my mom passed away 10 years ago. And even at that time, immunotherapy was started. They were starting to use immunotherapy with chemo or as a treatment then. So when I say fairly new, I don't mean like within the past couple of years. I mean like, it could be within 5 to 10 years. They help with inflammation, but they also work against multiple myeloma cells. And then, of course, bone marrow transplant, um, which is also known as a stem cell transplant, where it replaces diseased bone marrow with healthy bone marrow. Blood forming stem cells are collected from your blood and are given high doses of chemo to destroy your diseased bone marrow. And then the stem cells are put in your body and travel to the bones and begin rebuilding the bone marrow. So, yes. And of course, they treat it with radiation therapy. So, yes. Yes. So, that in a nutshell, multiple myeloma treatment symptoms. And diagnosis. So, how they diagnose. Yes. So remember, knowledge is power. A lot of times, like when you know these things, sometimes they don't seem as scary. And then sometimes you can just figure out what you want to do. Go with your instinct. Do what you feel is right. All right. All right. Keeping this short because internet keeps going in and out, and we're headed home. So after a fun weekend. So remember, knowledge is power. Take care of you, and we'll see you next week under the willow tree. Thank you for watching.